By releasing active ions, the material shows good bioactive function. Kind of a release of active ions continue all the time. And then it diminishes. They need to be exhibited when they are needed. On-demand exhibition of bioactive functions. To achieve this technology, we need to have smart bioactive materials.
Hello, everyone, and welcome to the All Pulp No Fiction podcast, where we discuss issues related to the dental community worldwide. Best of all, we do our best to host guests who have deep and extensive experience in their own fields. So, information you have here is evidence-based. Full disclosure, this podcast is supported by GC Corporation and is directed towards the dental professionals worldwide. So if you're not a dental professional, please refrain from listening and watching the podcast. Without further ado, let's get to today's episode. Okay, Professor Imazato, thank you very much for coming to us today.
Hi, my pleasure.
We know you have a very busy schedule, and we appreciate you very much for finding the time to come here today. In the beginning, I would like to, say a few words, about you. But afterwards, I would like you to introduce yourself to us. I know that you are the vice president of the IADR. Mm-hmm. You're also the head of dean and head of the graduate school, Osaka University Graduate School of Dentistry. Would you introduce us? Something that is not written in the CV. Would you talk about yourself? Something that is.
Okay, right.
Yeah.
Well, I graduated from dental school, Osaka University Dental School of Dentistry. So I'm a dentist as well. And I have been in restorative dentistry and endodontology department for 25 years, doing the clinic work as well as the materials development. And so I found a big interest in developing new materials. So I moved to dental biomaterial science department almost 10 years ago. And so I studied as mainly a researcher almost 10 years ago. But actually, I have been doing the research in the field of material science and also the conservative dentistry or restorative dentistry and prosthodontics for more than 30 years.
Wow.
Okay.
That's a very long time ago.
Yeah. And fortunately, as you introduced me, I was elected as the vice president of IADR. And thanks, I'd like to thank all of supporters and who supported me. And I started my vice presidency last year in June. And I will become the president-elect this year, in June. And I will become the president of IADR March 2024, next year. Yeah.
This sounds very great.
That's very honorable to me. Right?
It's IADR is a very big institution, and obviously you are adding a lot to it also. I just wanted to go back a little bit of in time and ask you for the reason why did you want to become a dentist in the in the beginning. Like, sorry to go back in time that long, but yeah,
it's okay. Yeah, it's fun to talk about my history. And my granddad was a dentist, and my dad was a dentist, and they had their clinics in a city called Nishiwaki. That is so-called center of Japan, but it's a rural area. But anyhow, my families were dentists, so that I had no choice to become a dentist other than becoming a dentist.
I see. Right. And while you were in dentistry, like I would think many people prefer to just work in clinics, or maybe just to open their own clinic and keep working there. Why did you become interested in academia and continuing research?
Okay, right. So actually I was supposed to succeed my dad's job in clinic, and everybody thought about that.
Yeah.
But I started my research work about the development of antibacterial dental composites in right after graduation. So it could be around 1987 or 88. And then I found a big interest in doing a research, and I completed my PhD. And then I visited Newcastle University in UK, and I did a research there for 1 year as a visiting researcher. And especially at that time, I was greatly inspired by all the researchers in Newcastle University. So of course, some of them were dentists, but their thinking way was always based on the science. So that inspired me, encouraged me very much. So after coming back from Newcastle in 1994, I further found a bigger interest in doing the research at the university. And by doing the research at the university, I could make so many friends in academics and also in the manufacturers, and of course with clinicians as well. So I could have the big, a kind of a big network, human network among the dentistry related people, and that was a big fun. So I enjoyed talking with a researcher, and I enjoy talking with academic person, and also sometimes enjoy talking with clinicians, because the clinicians always give me the good feedback, what should be made based on the research. So such kind of the human relationship was a big fun to me. So that's the reason why I decided to work at the university.
Well, that sounds great. I actually now I have two follow-up questions about that. First of all, like, how was your father's reaction to you not wanting to continue in there?
Right.
And the second question is like, having relationships with different type of people professionally, like academics and researchers and clinicians. What kind of feedback did you feel like the kind of information that you receive from everyone is different? Do they complement each other or no?
Right. Okay. Yeah. So the first question was a very good one. Because as I said, I was a third generation family, third generation dentist. So everybody around me believed that I would succeed my dad's clinics, but it's a long history, long story about my dad. And he was a dentist, but he spoke very good American English, and he was a famous person who could bridge between Major League Baseball in US and Japanese professional baseball league. So he worked as the kind of the consultant of the Japanese professional baseball league. And so, for example, when the American team came to Japan to play a game, he was invited, and he arranged something.
Okay.
And when the Japanese baseball team wanted to go to visit the US to have the camp, they asked my dad to arrange and to connect with them. So he was a dentist, but he dedicated almost his life to baseball.
Okay.
As a volunteer. Not a job.
Yes.
So when I told him that I will be in university and doing the clinic work and research work in university, and I will not succeed in your office, and he said, okay.
He didn't mind.
Yeah. So you can do whatever you want. I'm very happy about that. That's what he said.
Wow.
So I am very proud of my dad. Okay. And as for the second question, actually, all the information or responses given from the different kind of people were quite different, of course. From the researchers, for example, very scientific, very fine points. Sometimes I was asked how to develop the new material, how to modify the present material, and maybe almost all the time I was asked what kind of the future of the materials I was looking for, and also the what should be looked for by researchers. That was the main question. But from the clinician, of course, they do everyday clinic, and they have sometimes they have some the unexpected results by using some materials. So they mostly ask me how they can solve the problem by using different materials, or how they wanted to have the tips how to use the present materials effectively. And luckily, I was a dentist, and also I knew about the materials, so I could give some advice to them. And based on such advice, they, for example, clinicians told me that, oh, then from the other cases, I need this type of materials. Why don't you develop those materials? He says, based on the very clinical aspects, he or she says. So, and that is very helpful to me to develop new materials, to have the idea, and also the input from the researcher academicians about the on the scientific base question, what type of the materials can be future. So I always think both ways.
You see,
Yeah,
I mean, yes, like different opinions also, help, different point of views help, us produce
That's right.
better ideas,
Yeah.
right? Yeah, quite interesting. Going back to the subject of, you being a professor and obviously having graduate students in your department, how do you choose, the research topics for your graduate students? Like, from what I know about you, you do a lot of regenerative, research. How is the relationship between you as the head of department and the students who want to join your research groups? How does the planning for the projects go?
Okay. Well, basically all of the students come to my department after looking at our homepage, and or sometimes after listening my lecture
Yeah.
at the conference, if they had some interest in some topics running on in my department. That is the beginning. But once I received a contact from them, I started to discuss with them what is their main interest, and what they want to do, and what they will do after graduation from graduate school. And I usually have long discussion with them these days through the Zoom online. And but even before the COVID-19, I had such kind of discussion by inviting them before getting into our course to my room, and I always had a good discussion with them. And the reason is that I'm happy if they do what they like. That is the most important point, Unless they do what they like, they will not be successful. They cannot get success.
Yeah.
And of course, some short success they may get, but for example, PhD course is a 4 years course, and with the mass of the research work they need to do, and unless they are interested in, they are not happy.
Yeah.
So I won't make them happy by doing the research, just like I did when I was young. So after having such kind of discussion and knowing their interest, I proposed them what research we are running on in our department. And actually, we are running 3 different types of the big projects: material science, tissue engineering and regeneration, and also the biomechanics. Those all 3 are 5 different topics.
Yeah.
So I showed them and explained them what we are doing, and I don't make them decide promptly. I give them a short while for sometimes half a year and sometimes a year, watching every projects in our department. And
Before starting their own project.
yeah, because uh, because watching is better than knowing, you know. So even though I explained, they cannot realize totally, of course. So once they come to Japan and they start life in Japan, I make them free to learn Japanese language and also learn about the Japanese culture, going anywhere. And after that, and after they knowing and observing the actual research work running on in our department, and what kind of supervisors we have, and then I again have the discussion with them, and what is real interest, genuine interest for you, and then they can give me the quite detailed answer. So and thinking about their interest, I discuss with our supervisors again, and what kind of the detailed topics they can do among the such kind of the big projects, and if they finally agree, our PhD students start their work. That is my style.
Well, that's actually great. I don't know if everyone does it this way. I don't think that many professors do it this way, but I believe your students are very lucky, to have this opportunity.
I hope so. And of course, I know sometimes they may be confused at the beginning because some people came to my department to start their work promptly and spending 4 years, all 4 years for their work. But I always tell them, wait a moment.
Take some
Let's think.
I see. So, Professor, you mentioned, the 3 types of research that you're doing in your department. Can you tell us a little bit more about it?
Okay. As I said, we have 3 big projects, and one is development of the biofunctional materials, bioactive materials. So I studied my PhD work more than 30 years ago, and that was about development of antibacterial dental composites, and that was not popular at that time. Everyone was doing the research about the dentin bonding or how to strengthen the materials, and such kind of the research were very popular. But I found a big interest in doing the research different from others. So, and fortunately, after especially the introducing MI concept by GC company to dentistry in 2000. That was proposed by FDI, I think. Anyhow, based on such kind of the paradigm shift of the treatments, people thinks about the importance of the biofunctional materials. And these days, they are becoming more and more popular, and people find a big interest in application of the bioactive materials. But anyhow, I have been working on such kind of work for many years, many years, and I don't have enough time to explain all the projects. But anyhow, material with antibacterial activity, material with tissue regeneration ability, and the materials are not only for restoration but also for endodontics or some other regeneration as well. And so I have been doing the one in that project. Our group is doing the kind of the variety of the development of variety of materials, and that project is run mainly by Assistant Professor Dr. Kitagawa in my department. And the second project is about the tissue regeneration, tissue engineering and regenerative medicine. and the associate professor Dr. Sasaki in my department. He has a very good skill to produce the scaffold-free cell aggregates with a large scale. That is quite interesting. And so, utilizing his techniques, I talked with him and started the usage of such cell aggregates for bone regeneration and also for pulp regeneration. Yeah, and also in this project, I'm working with GC company, and I was very lucky to have good material eventually, so-called air shield, Cytrans air shield. That is a two-layered barrier membranes for GBR, and such kind of material development are also included in that project. And the third one is biomechanics. And the associate professor, Dr. Yamaguchi, in my department, he's a computer engineer, and he has very good skill about computer science. And so we have been doing the combination of in vitro test and in silico test to analyze the various materials, of course, using finite element analysis and some other special technique using computer. And also, the Dr. Yamaguchi is very good at the AI. So his application, he is applying AI to various dental treatments, also the material design. For example, he is developing the AI to give the answer what components of the materials are best to have the strongest material. And also, in collaboration with clinical department, he has developed the AI to help deciding the drilling protocol for implantology. So the computer science is quite expanding, and there are many possibilities, So he's doing different work using the computer. So all those three are quite different big projects.
I mean, these are very big projects, much bigger than what I expected, to be honest. For this last project, Dr. Yamaguchi, did you say, is he a dentist or?
No, he's not a dentist.
Okay.
Yeah, he is from engineering field.
I see.
Yeah.
So, okay. So I was like, wow, a dentist and doing all the research. Okay, so maybe if we talk about the regenerative tooth therapies, what's the state? Like you said, like previously, this was not the most popular kind of research, but you decided to actually do it, and for like bioactive materials, right? What's the current state of bioactive materials, and where do you see it going?
Right. So as I said, today nowadays there's some confusion about the definition of bioactive materials. This is not the fault of GC company. I don't say. Many companies, dental manufacturers, claim their composites are bioactive because they release fluoride or calcium to stimulate appetite formation. And I suppose this is because we have the bioactive material, so-called MTA or silicate, calcium silicate cements, and they can induce dentinogenesis or promote healing of periodontal tissue when they are applied for root end filling or sealing of the perforation. And they release a high amount of calcium. And that is true. Those are good materials. And probably based on such kind of the phenomena, dental manufacturer wants to name their composites as bioactive because it can help remineralization. So, but I think that is the only one aspect of the bioactivity for the dental treatments and care, because there are so many components that should be considered for better success. And for example, in addition to remineralization or promotion of hard tissue formation, of course, for example, control bacterial infection or the inhibition of inflammatory response or the promotion of tissue regeneration. Those kinds of the functions should be applied even for the restorative materials, but also for the other materials that are useful widely in dentistry, of course. So from my point of view, bioactive functions for dental materials and care or the dental treatments, those kinds of the different aspects, and hopefully biologically interact in a positive way to human tissue. That is the but for me, that is a true definition of what the bioactive functions. So I'm trying to develop those kind of the materials with new functions, and one more important point for me is that exhibition of the action should not needs not does not need to be always, you know. The materials, for example, by releasing active ions, the material shows good bioactive function.
Yeah.
But it always happens, and such kind of a release of active ions continue all the time, and then it diminishes. That happens quite often, you know. But as for some bioactive functions, they need to be exhibited when they are needed. So that is a kind of on-demand exhibition of bioactive functions. And to achieve this technology, we need to have smart bioactive materials. You know, the smart materials in the engineering field are very popular. The most typical one is shape memory alloy, and by the changing of the environmental temperature, they change their style, they change their form. That is a simple example of the smart materials. And in dentistry, smart materials are not yet popular. And so one of the possibility, for example, is the acid-responsive restorative material that inhibit cariogenic bacteria when the biofilm becomes acidic and dangerous to cause the caries. But even if the biofilm is stable and does not cause any acid, of course, hopefully we don't want to have them at all, but it's not possible in clinical settings.
Yeah.
So even if the biofilm is formed on the materials or around the tooth surface, if they are in a healthy state, that is symbiotic biofilm. That is okay. But once they becomes the dangerous way, I mean, that is so-called the dysbiotic biofilm. We need to have something to kill the bacteria, cariogenic bacteria in the biofilm. So according to the production of acid by cariogenic bacteria, if the materials releases some active agent to kill the bacteria, that is enough. So that is one of this concept of the smart bioactive material. So we are now moving on to the continuous exhibition of the bioactive functions from smart bioactiveness.
That sounds very interesting, and yeah, I was just thinking like, yeah, this material would be smart, and then you said smart bioactive material, so it sounds great. What do you think? What is the state right now of these kind of materials right now? We are just doing continuous release of ions, and where do you see like how far are we from having these kinds of materials?
Right. Yeah. To be honest, these days I have been involved intensively in developing the smart bioactive materials, but it's somewhat difficult. I found it difficult, and because it should react against the environment, for example. And that means there needs to be some sensor, good sensor, to feel the environment. And we need to have good actuator that gives the, bioactive functions. And those two technologies are, quite difficult to develop.
Yes.
and and especially oral environment is quite complex, as you know.
Yes.
The so many bacteria in saliva we have, and pH changes, the temperature changes. So, for example, to develop the thermal resistant material for the spacecraft, that is more easier. In terms of the complexity of the environment.
Yeah.
So, to be honest, we are far from the goal.
Still there.
Yeah. But actually, there are so many different trials from the different institutions or university research by researchers about developing the new type of the bioactive materials. And I think hopefully the combining those technologies together, or having some whole design of the materials, picking up those interesting work, I think we can move on. That can drive our trial moving to the goal more easier, I think. But anyhow, it has not yet started, of course. And so the current status can be quite, to be honest, it's a very simple bioactive functions that are exhibited continuously, mainly by releasing some active agents. It's the most simple way, and so we are still at the beginning of the developing the final bioactive materials, I think.
Yeah. Thank you very much, Professor. Regarding like bioactive materials and maybe not bioactive, like materials that in general use in dentistry, and like most of us think of, restorations and such on, but also like materials that we're using for regeneration, like you mentioned that, when we were talking about what kind of research you're doing in your department, materials used for bone regeneration also like are a big part of our practice in dentistry. How do you see the development of this field in recent years? Because there are the kind of a complex approach to bone regeneration. How do you feel it? Like, is like I from what I've seen, my research was on iPS cells. So some institutes prefer the cell approach. Some of institutes prefer the graft approach, and it's kind of a complex mechanism. So how do you see it, from your point of view?
Right. Yeah. It's a tough question to answer. No. So this may not be a correct answer, but I can say that the regeneration in dental fields are quite diverse and somewhat different from medical fields, because basically the regeneration of the tissue related to dentistry have two aspects: the regeneration of hard tissue, and the other one is regeneration of soft tissue, and those are compressed usually. And such kind of the regeneration is basically difficult, especially when we have the in situ approach. I mean, we can produce any type of the organs outside the body, and in a flask. It's possible. And you know IPS, so I think you know that we can produce the tooth itself from iPS cells, but what is important is that how we can apply for the treatments.
Yeah.
And when we think about dental treatments, we need to have the special regeneration techniques or materials that can be used in oral environment and effectively in situ. So in that sense, for example, the regenerating the tooth itself out in a flask and put into the jaw bone is not practical, you know.
Yes.
So we need to have different approach to make the tooth inside the mouth. That is more important, and that is closer to the clinic work, of course. So what I can say is that there's, considering such kind of the situation, dentists always need to know the more about regenerative therapy in the medical field and how we can incorporate them into the dental fields. And so from that sense, I think the knowing the development of biology in dental field is important, and also the tissue engineering technology that was that had been first introduced by Bob Langer, and he produced a big ear shape on the mouse by using the tissue engineering cells, scaffolds, and the nutrition growth factors. And so knowing all those components and how they work together, they act together, and then we need to have the idea how to apply into the mouse.
Yeah.
And so those kind of the the targets. I don't say problem. That targets are quite tough. For example, compared with the regenerating liver outside the human body, that is more easier. So sorry, in that sense, I'm sorry, I don't give you the correct answer.
No, this is actually quite
Yeah.
insightful. Actually,
Yeah, but
thank you
so
so much for the answer.
I think this is the situation of the regeneration. And what we need to think about the regeneration in dentistry.
Yeah. So as you mentioned, like it's quite multifactorial. It's not one dimension.
Yeah.
So we
Yeah.
have to look at it from different angles. And yeah, probably this is why, the oral cavity is, quite a complex environment, right? So one of the questions that I was preparing right now is that, doctors in their, clinicians nowadays, hearing about bioactive materials, hearing about, materials that you use for regeneration, like bone regeneration, such on. What are the things that they have to keep in mind when they are looking for this material? What are the characteristics that, they have to always think about when choosing a material?
Right. This is again not the proper answer, I think, but I have been working on development of bioactive materials for many years, and also worked on the regenerative therapy for many years these days. And but what I always think is that the material itself cannot be the perfect for the therapy. Material can have the therapeutic effects, but it should be considered as one part to have the oral health promotion. So, for example, attacking the biofilm, the material can attack the biofilm. That is very useful. But thinking about the complexity of oral environment, we need to think about the condition of saliva and of course, the general health of the patients, and also maybe some structure dentition of the tooth, or the how many restorations they have as well, and such kind of all those information should be considered at the together to have the final oral health for each patient. That is a kind of the custom-made or tailor-made health promotion, oral health promotion for each patient. And I would say that for example, materials with the bioactive functions of material for regeneration can be a big part, but it's still the one part. So considering the other regimen to have the prevention of the further diseases, or also the consideration about general health and modifying them, or changing their daily habits, or making them more practice every day, or something like that. Such kind of the total frame, including the many different multifactorial aspects, should be got into the one folder. That is the most important point, to have the goal for the happiness of the patients. Right. So I can tell you that I have the big interest in materials, and the dentists sometimes only focus on materials, and if they use this material, or we can have the success, but it's not true. Yeah. So materials are one aspect, and
Yeah.
so please, I always tell clinicians that please keep in your mind that you should use the best material to give you the best condition and the best results, but that is still the one aspect. So please consider totally about oral health.
Yeah, that makes a lot of sense, especially recently in recent years, like many manufacturers are all producing very good materials, and if you always if I don't want to say it in a bad way, but if there is always a failure in a certain thing, then it probably you need to review the whole process and not just the material itself. Yeah. Right? Yeah, thank you very much, Professor. One more question that I was thinking about is that like right now we said, like there are many materials that we're using for regeneration and like bioactive materials. How do you see the next 10 to 20 years of having regenerative tooth therapies, or like bioactive materials? And like you said, like one of the research that you're doing is the use of computers and AI in cooperation in these kinds of treatments. How do you see the progression of this field happening in the next 10 years?
Okay. Okay. So I think this is my hope as well. But I think the material for regeneration will be combined together with bioactive functions. Actually, the materials, even for regenerative therapy, those days are quite good. And for example, the side-trans granule, the carbonate apatite granules DC made, are quite good material as bone substitute. And again, the barrier membrane side-trans air shield, that is also a good membrane, the synthetic membranes. And in many cases, they can be used successfully. And of course, selection of the cases are important because of the limitation of those materials usage. But anyhow, such kind of regenerative materials for regenerative therapy are now in a quite good state, I think. Okay. And so, but the ideal way to go is to have the further better materials to increase the success rate of the treatments in any cases. That is the ideal way. And so for that purposes, again, I'll tell you that the combining the different aspects in one feature is very important, and that can be the addition of the fail-safe function sometimes, and addition of the very positive action to enhance the regeneration. And anyhow, the combination of bioactive functions with the regenerative materials can be a good choice to have the better success. So, for example, in detail, the membrane with antibacterial activity to control infection will be useful, and also the bone substitute with bacterial infection control may be good, and such kind of, or of course the barrier membranes are further better to induce the tissue regeneration more and more. That is good, but to achieve these goals, I think we need to have combined together to have the additional effects or sometimes synergistic effects. And to do that, combining two different aspects of the bioactive functions and also the materials, goodness of the materials themselves together are very promising, I think. So the one way is to how they can be progressed is that the bioactive materials for regenerative therapy will appear. Another way is very, very simple from the clinical aspect, that for one material, some clinicians feels, oh, this is very easy to handle, but some clinician feels, oh, it's difficult to use.
Yeah.
That always happens.
Yes.
And even if we provide some best materials, we think some clinicians don't like their handling ability, and some clinicians don't want the manipulation of such kind of material. That always happens. But we should not go average. If we go for average, some components are compromised. That is not the ideal way. So, for example, for regenerative medicine, especially regenerative medicine is a tailor-made, custom-made. So, as for the materials for regenerative medicine, we should have the family members with a different handling ability or different regeneration ability. And of course, I know it's sometimes not good for the manufacturers to have the series of the materials, but I think the future dentistry is more personalized, and of course based on the genetic information. Because we have more and more genetic information these days, and that can be utilized for dental treatments as well. And such kind of the genetic difference can be, probably identified by AI as well. So based on those information, we should provide the suitable materials for each personalized care. So in that sense, we should have the family members of one material for regeneration. I think that is another way, I think.
See. I mean, I think we're still kind of a far way from, having, like when we see in the movies, with the press of a button, you can get a replacement for something. But what you mentioned, Professor, is actually, yes, I think this might be quite, possibly very near in the future, especially with the boom of the AI applications nowadays.
Yeah, that's right.
Yeah. Anyways, Professor, thank you very much for your time today. This was very lovely and very educational for me.
Oh, my pleasure. I quite enjoyed talking with you.
Thank you very much, Professor. And hopefully our listeners and our viewers are also going to enjoy today's episode. So yeah, thank you very much for today.
Okay, thank you very much. And I'd like to thank GC at the end for supporting me and also the giving this chance to discuss about the future of the materials. And I enjoyed a lot. And I also would like to tell all the audience that if they find some good feedback to the research, don't hesitate to tell me. Then I can develop the further better materials. Thank you very much.
Thank you very much, Professor.